All right, let's get into audience questions for the week. Very timely one from Joe. Joe says, "Hey, David, I'm glad you're recovering from surgery. Can you talk about your recent healthcare experience, relate it to Bernie Sanders, and then compare and contrast both with Americans who are not insured or underinsured?" Yeah, so listen, I mean, there's a lot here. If you don't know, I recently had an emergency appendectomy. I missed last week's Thursday show and some of the Friday show. Some of the elements of it were taped earlier in the week. And I have insurance. And I was in a position where I went into an emergency room. Actually, I went to urgent care first and was told I was fine. And then hours later was in an emergency room anyway and had immediate, CAT scan, blood tests, all of that stuff, was scheduled for surgery once it became clear I had appendicitis. And I'm guessing that part of the reason why it all just happened was that the hospital, because it's a network hospital with the network I'm associated with, already had my insurance information, knew I had insurance, and there were no questions about it. Now, that being said, I have a silver level plan here in Massachusetts. It cost me $421 per month, and it still has a $2,000 annual deductible. I believe it's a $1,000 deductible for imaging. So that CAT scan, I've been billed $302 for that CAT scan. I'm anticipating that the remaining $1,700 or so of my deductible will be billed to me. I don't know in the end what the procedure will cost. I've read that appendectomies in the US can range between $1,500 to $180,000, depending on, I don't even know what, which is crazy in and of itself. But I know, I mean, listen, I have a savings account. If I'm prepared to have to pay the $2,000, and I know that I might have to, I think my annual out-of-pocket maximum is $7,500. I have that in savings, so I know it's not going to bankrupt me. Now, if I were not insured or underinsured, the circumstances would be different. And also they would be different if I didn't have money in savings to self-insure against the maximum annual costs of the plan. Now, in the hospital, I had hours during which I was just looking around, just sitting there. And there are signs that say whether or not you have insurance, and I think this is Massachusetts law, but I think most states have something similar. Regardless of insurance status or ability to pay, I have to be given stabilizing treatment and, if necessary, a transfer to another facility. Now, if you go in with acute appendicitis and you don't have insurance, what counts as stabilizing treatment? The appendix has to come out, or you can try to treat it in some cases with antibiotics, although in my case, they said, you really should have it removed. Is anything short of an appendectomy considered stabilizing for someone with acute appendicitis? I don't know the answer to that. Those are the types of problems that would ultimately present themselves for someone who is uninsured and underinsured. By underinsured, I'm guessing we're talking about a catastrophic plan, which instead of running $420 a month like I pay, I think it's about half of that. Like it's still $200 a month, I think. What happens? Or if you have a subsidized catastrophic plan where you might, because of your income, only pay $60 a month. But if you go in there, you might have a $7,000 deductible that has to be met. What happens? You're screwed, basically. Do you go into bankruptcy? I don't know. Do you go into this debt collection industrial complex and then potentially start paying interest on top of the bills? I mean, this is why the system doesn't make sense, because as soon as you're in that sort of hamster treadmill, as it is effectively, you are going to be even more hampered in your ability to get out of it, because at that point, you have trouble potentially making your car payment. If your car gets repossessed, how do you get to work? You need to go to work in order to make the money to pay off the medical debt. And you very quickly start seeing the snowball effect and the negative externalities of this. So, I mean, listen, my situation, Bernie, I'm sure, has far better health insurance than I have. It's not good. It's not good when you consider that when you don't have that, and you don't have some money saved, which I'm fortunate enough to have, you are, Would I have delayed even going to urgent care or the emergency room? I had a $55 copay at urgent care, which ended up just sending me home with appendicitis instead of saying we should actually do some imaging here. You probably delay going, which can lead to a burst or perforated appendix, and then it gets much more expensive. It's a mess. It's extraordinarily depressing, and it's got to be fixed.